Hey, somebody told me you wanted to improve your IV cannulation skills. Maybe see some examples from different camera angles. This is the video for you. Welcome back to Paramedia. Today we are going to go over intravenous cannulation. So we're going to use the Braun Vasofix cannulas. Other brands are available, but those are the ones we've got today. We've got 6 sizes of cannula, so we'll work from smallest to largest. But before we do that, we'll have a bit of an in-depth look at the cannulas themselves, talk about some of the differences between them. So if you are a student at uni, if you're a paramedic on the streets, a midwife out in the community, or you're a nurse or a doctor in the hospital, or just interested in cannulating, what the actual process is, this is genuinely the video for you. So let's get into it and let's have a look at a bit more detail on the cannulas themselves. Here the cannulas are laid out in size order: 24 gauge at the bottom, 14 gauge at the top. The gauge, just a point of note, is that the smaller the number, the wider the catheter that stays in the vein. So the 14 and the 24. On these smaller cannulas, generally considered for sort of pediatric use, it's important to note that the cannula that stays in, even with the introducer, it's much like more of a hair. It's quite flexible, so it can be difficult gaining access through thicker skin. It seems to want to sort of bend a bit. As we go up, we get to the pink. The pink cannula is slightly different from the blue and the yellow there in the fact that it's got these holes on part of the base plate. So these wings are to support the cannula once it's in the vein and on the skin. And these holes are to suture the cannula into position. And that may be important, especially if you're a military medic or you're out in the wilderness. This is the beveled end, or the business end of the introducer. It's cut a certain way so it creates a V shape as it goes through the skin. This introducer will be taken out once in position in the vein, leaving behind this flexible catheter. As I mentioned, on the base plate, it's got these wings to hold it on. You have a port at the top with a one-way valve, so you can place medications or fluids with a syringe just into the top. But if you leave the backing off of this, blood will just come straight up the catheter and will come out the top. So it's important to remember when you are removing the introducer that you're going to take this cap off the back and place it like so onto the back of the base plate, and that will stop the blood. As part of the cannula here, we have the flashback chamber. This is important to note. If I hold it up like this, you might see there's the end of the introducer, that little black hole. What will happen is once you pierce the vein, as soon as blood is able to travel up the introducer, it will come out of the little hole in the top and fill this chamber. So when you see blood in this chamber, it lets you know that you've pierced the vein. Now we are nearly ready to cannulate. Before we do that, we've just got to gather some kit together. What you're going to need is you're going to need some gloves. You're going to need a tourniquet of some sort to pop around the limb and help to gorge those veins. It's easier to access them. A alcoholic swab, just to swab the skin before puncturing it. You have a Tegaderm, and then you're going to need a flush, so some sodium chloride and a little 5mm syringe, just to confirm that we're in the vein. And let's not forget that we are going to have to explain the procedure to the patient, gain consent, position them and yourself comfortably before you apply that tourniquet. Now for the moment we've all been waiting for, gaining access. So here we've identified these 2 veins that run over the thumb knuckle. They're quite small, and we've done this on purpose because the cannula that we're also going to use is the smallest one, the 24 gauge color-coded yellow. This cannula is typically used for neonates or infants. Here I've pulled the skin taut just to help to fix the veins down, and a low angle of approach with this cannula because these veins are very superficial. As you can see here, we're just about to pierce the skin. I'm taking my time. This cannula is quite flexible. It's got a very small introducer. It's less than 1 millimeter across the actual catheter itself. So it takes a little time to pierce the skin and get into the subcutaneous before piercing the vein. Also, being so narrow, it takes time for blood to come up the introducer into the flashback chamber. If we were to rush this, by the time we notice that there's blood in the flashback chamber, we could have already pushed the introducer through the underside of the vein. Again, taking time here. There's no rush. We're just about to get flashback. There we go, a little bit of flashback. As soon as we see that, I'm going to lower the angle down to the sort of horizontal or down to the skin. A slight upward inflection as I push the whole system slightly further into the vein, just to make sure the bevel's definitely in, and then slide off the cannula off the introducer. Pause. Can relax at this point, tourniquet off. Just making sure, I'm being quite careful here, making sure that the cannula doesn't fall out. The catheter's length is only 19 millimeters, so it's under 2 centimeters. So you just saw us remove the introducer there. It's a slightly different angle. You can see this low angle of approach. Again, taking our time. There's blood in the flashback chamber. So we go down to the horizontal, slight upward inflection just to get the bevel in. Make sure that the cannula is in the vein before sliding off. Having a bit of problems here, just because this whole system is quite flexible, because the needle within the cannula is very thin, whereas on the bigger cannulas it sort of holds it a lot more firm. Tourniquet off. Again, being very careful that it doesn't fall out. Going to occlude the vein before removing the introducer. On the back of the introducer is that cap, so I'm going to use my hand here just to take that cap off, and then going to replace it onto the end of this little bit of housing. Here I lift my finger off the vein. I just want to see if any blood, out of curiosity, comes back up the cannula. It doesn't always happen. It doesn't mean you're not in the vein, although it would have been nice to have seen that. I'm going to speed things up here as we secure everything down, those wings on the base plate. We're going to bring the clear plastic top part of the tegaderm over now. We want to make sure that we can see that puncture site through that clear plastic window, and so we can make sure that it's not becoming infected. This cannula here, you can pass 22 mils of fluid per minute through, so it's not a great deal, hence used on tiny humans. It's flushing well, so we know that we're in the vein. Here we have the palm side of the wrist, the volar wrist. I'd choose this area if the patient had a high BMI and it was difficult to find veins in other areas. Bear in mind though that there are 2 arteries and some nerve bundles that run through this wrist. We're using the blue cannula here, the 22 gauge. This is the next size up, and here you can see from this angle that we're going in at a very low angle. These veins are very superficial. Again, slow insertion, wait for that flashback. It's going to just come into the chamber. There we go, just a little bit of flashback. Drop that plate down to the skin, slight upward inflection, and push the cannula off the introducer. Just relax at this point, take the tourniquet off. I'm going to apply a little bit of pressure just over the catheter. This catheter is about 1 inch long, so it's 25 millimeter, still under 1 millimeter in width. This cannula will allow approximately 36 mils of fluid per minute. Popping the cap on at the back. This cannula is perfectly fine for administering drugs in a patient, if they need a little bit of pain relief or some ondansetron for sickness. There's no problems here, but getting a lot of fluid through it quickly, it's just not going to happen. Get it nice and secure, and then we'll move on to our next cannula. The next cannula we have is the 20 gauge. It's color-coded pink, and They're not my gloves, we've switched over. So I have another paramedic is just going to cannulate here. She select a vein on the dorsal hand. It's a little bit of a larger needle now. She's going into a bifurcation, which is always a good area, nice and secure vein. She got flashback very quickly there. Secondary and a little spot of blood, and that's absolutely fine. Some pressure over the end of the catheter just to stop any more blood coming up. Again, all the time in the world. Just going to secure the cap onto the end of the cannula. This cannula can, you can push 61 mils of fluid per minute. Here we are, slightly different angle. This is the same cannula, again, just at a different angle. So again, the angle that the cannula is going to come into the skin is nice and low. Unfortunately, not quite got the flashback. Oh, there you go, in shot there. Base plate is on the skin, sliding that catheter off the introducer. Spot of blood, but again, she's just occluded the end of the catheter with her thumb to stop any more blood coming up, and there's no rush at this point. Cannulation generally should not be rushed. It's the most painful cannulas are the ones that you don't get into the vein. So if you take a little bit of extra time, slow everything down, and as you improve your technique, your speed will improve as well. There we go, and it's flushing nicely. We are going to go with the green 18 gauge needle, the workhorse. It's sort of middle of the road. Here we've got the medial vein of the foot, a nice bifurcation just at the base-ish of that tattoo. Pull the skin taut just to kind of secure that vein a little bit more. This cannula is quite a bit longer than the others. It's 45mm into that bifurcation. Again, nice and slow, looking for flashback. There it is. Base plate onto the skin, slight upward inflection. I drive the cannula into the vein a few millimeter just to make sure the bevel's completely in before sliding off the introducer. Again, no rush, tourniquet off. We'd use the foot potentially if you couldn't gain access or if there wasn't a decent vein around the arms. It's pretty uncommon, but they're utilized every now and again. Popping the cap on. As you can see, a green's not a bad size cannula for the foot. You can get almost 100 mils per minute of fluid through it. Securing it there, Tegaderm on. I want to be able to see that puncture site, make sure that there's no redness or swelling or sort of infection. Gonna flush it through. There we go, cannula's in. We are definitely going up in sizes. This is the 16 gauge, a grey cannula into the ACF. This cannula is, all my midwives out there loving it. This is your small cannula, 16 gauge. It's 5 centimeters long and it's almost 2 millimeters in width, and you can get 196 mils of fluid per minute through it. This is going to be very quick, very superficial vein. Almost instantaneous flashback, base plate to the skin, upward inflection. Got to be really careful on these cannulas because the bevels are so big that you can easily scrape or pierce the underside of the vein. Slightly different angle. Almost as soon as it touches the skin, there's flashback. Nice big vein in the ACF. You saw me drop that base plate down to the skin, upward inflection. Making sure that the bevel and the catheter were in the vein before sliding off the base plate. Again, now we're here, taking our time. Tourniquet's off, remove the introducer, take the little cap off the end, and place it. Again, it doesn't take long to place these. Obviously, if your patient is needing some sort of life-saving interventions, the veins might be quite flat, they might be quite hypovolemic. Securing everything down and flushing, just to confirm that we are in the vein. Here's the moment we've all been waiting for. This is the 14 gauge, the largest cannula that we have. It's again 5 centimeters long, it's 2.2 millimeters wide, and you can get 343 mils per minute. We're going just below the ACF, and this is into the forearm, and it's slightly diagonally away from the camera. What we're doing is we're just making sure that we're lining up with the vein. Again, very large bevel at the beginning, at the front of this. Slowly, 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 making sure that we don't rush things too much. Flashback, base plate to the skin, slight upward inflection. Again, because we're going diagonally away around an arm, you can't really see it. Great secondary flashback there. And we've slid the cannula off the introducer. Another angle, so you can see we're coming across here, slowly, slowly into the skin, making our way down into the vein. Flashback, so base plate to the skin, slight upward inflection, make sure that the bevel is in the vein before sliding off the catheter itself. Secondary flashback there. Again, a lot of pressure just because it's a big wide cannula, just to make sure the blood doesn't run back up. We've got our cap just onto the end there. A little bit fiddly. Tourniquet comes off, and we've got our cannula in place. We'll just speed everything up here. Again, just be mindful not to cross over these two strips. Make sure that we can see the injection site, and everything flushes. Well, there you have it. IV cannulation, a few different angles there. I hope that you enjoyed that. If you want to see more content like this, do like and subscribe. And I will endeavor to get another video out in less than 2 years, which was the time between the last video and this one. So we'll try and release one something like that every month or two. So just as we're getting this whole thing off the ground. Thanks very much for watching. See you next time.